Eldercare is a new fact of life for aging Canadians and the baby boomers. Today, adult sons and daughters with demanding careers find ourselves juggling work, life, and care responsibilities. We are the sandwich generation between the care needs of aging loved ones and our children. Research shows that families are, for the most part, unprepared for the eldercare challenges that lie ahead. Many people move directly into crisis situations, make plans as they go, and regret not making decisions about aging issues in advance. Juggling these demands often creates stress for you and can often impact your attendance at your workplace. Your employer understands the stresses that are set upon you, and this is why they have chosen to provide this information session on eldercare options. Solutions to help you make the best decisions for your aging loved ones. My name is Gail Giordani, and I am a registered nurse and Vice President of First Healthcare, an accredited healthcare company providing the Eldercare program to your workplace. Over the next few minutes, I will be talking to you about eldercare options available to you and your aging loved ones. There are many stages in life, each with its own unique demands. If you are facing difficult choices for yourself or an aging loved one, please know you're not alone. During our time together, I will tell you about the various options in eldercare available as your aging loved ones move from independence in their own home to caring for your loved one in a more supportive and safe environment. Eldercare planning in advance may be the most important thing for you to do for yourself, family, and elder-cared loved ones. Almost everyone you speak to has an aging loved one in their life that they worry about. To help this person effectively, you must develop a care plan. Take a moment to discuss present and future wishes of everyone, including your loved ones, and make a list. This list will include care needs, resources available, and who is available to help. In the beginning, it may be small changes that you notice. Maybe your loved ones are becoming more forgetful. The house doesn't appear to be as clean as it used to be, or mom doesn't cook anymore. In Canada, 75 to 85% of caregiving to older adults are family friend caregivers. Oftentimes, the caregiver is balancing work and family life. This balance becomes hard to maintain and can be very stressful for everyone. If the caregiver does not seek help, they risk becoming burned out and not being able to function at home or in the workplace. When your parents don't need support 24 hours a day, a good first step could be using a personal emergency response system. The system connects your elderly loved one to a 24-hour call center with the push of a button. When your elderly loved one pushes the button to seek help, the responder will then call EMS or a family member for assistance. There are even more sophisticated personal emergency response systems on the market, such as First Watch, that not only connects to the call center, but connects your loved one to a nurse to provide support and reassurance while waiting for EMS to arrive. You may find names of local emergency response systems by speaking to your eldercare consultants, family physician, or local regional health authority. You may also find names on companies in the internet and on a phone directory under the column Personal Emergency Response Systems. When more support is needed to help your parents stay at home and look after themselves, people will often turn to home care. In Canada, home care is defined as a number of services that helps and supports people to live in their homes. These services include both medical and support services. Services could include nursing care, personal support, or homemaking. This is often used to prevent, delay, or substitute long-term as your elderly loved one's independence deteriorates. Home care services and costs vary from province to province. Private and government options are available. If you feel home care or some support is needed, call your local government home care program listed under the phone headings Ministry of Health and Long-Term Care. In private home care, there is no limit and services are based on pricing and one's ability to pay. It is important to look for organizations that are accredited, responsive to your needs, and are available when you need them. Accredited healthcare companies such as First Healthcare are available 24 hours per day and are able to assist you immediately during a crisis. You may find a list of accredited healthcare organizations by calling your local regional health authority or log on to Accreditation Canada and look up accredited providers in each province. When care and support in the home is more than what the home care option provides, you and your loved one enter into the seniors' housing continuum as their independence decreases. Moving from home to retirement home to assisted living home and then finally to a long-term care home can be time-consuming, but having a full understanding of each will help you navigate the system more effectively. Retirement homes provide accommodation for those who can no longer manage daily living with independence. However, many people in these homes are fairly independent. Retirement homes provide meals, social and recreational programs, 24-hour staffing, laundry and housekeeping services. Medication supervision or administration is often available, as well as limited assistance with personal care. As care needs increase, some residents choose to bring in home care to help them, while others may just choose to transition into a long-term care home. In an assisted living facility, you will receive more assistance than if you lived in a retirement home, but less care than one might find in a long-term care facility. Assisted living facilities or floors are typically located in homes where residents transition to more dependence on nursing and support services. There is a lot of variation in terms of services and even in terms of what they are called from province to province. Touring these facilities, meeting with the management of these homes, and looking for references are all important steps in deciding which home works best for your loved one. Long-term care homes take care of people who are no longer able to live independently in their own homes, even with a wide range of community support. They provide nursing and personal care on a 24-hour basis, as well as access to physicians and other health professionals. Long-term care is governed by each individual province, so accessibility and fees vary from location to location. A Ministry of Health case manager or social worker can assist you when choosing a long-term care facility that best meets the needs of your loved one. Most of us are not equipped with the necessary knowledge or tools to take on the role of caregiver when the time comes. Each situation will be different. Knowing what elder care options are available helps you prepare for your elder care challenges that lie ahead. I hope you have found our time together to be educational and informative. First Healthcare is your national elder care provider. Congratulations! You are well on your way to making decisions about elder care issues in advance.